It's easy to take for granted our access to clean water and sanitation practices that we have in our country. Sadly, not everywhere is lucky enough to have the same infrastructure and education. Access to clean water is central to life. It can even prevent the spread of disease. The Maji Safi group strives to educate communities in rural Tanzania about best practices for hygiene, sanitation, and clean water. And here to tell us more about the Maji Safi group and how they're impacting Tanzania is co-founder and president Bruce Pells. Good to have you on the show.
Thanks for having us.
So tell me a little bit about the Maji Safi group.
So the Maji Safi group is an organization that focuses on preventing disease and promoting healthy habits. And to do that, we really invest in women and youth and put them at the center of going out and changing their communities' habits and public health situation.
Now, I understand you lived in Tanzania for how many years?
I've lived there for over 6 years.
Is that why you invested and dedicated so much of your professional career to water?
Yeah, water, as we all know, is so central to life. And, you know, living over in Tanzania, you see what a big barrier a lack of clean water is to climbing out of poverty. I also think that water is very undervalued, especially economically, and it's a very valuable resource that we don't protect enough.
Right, I agree.
And that's part of the reason we wanted to do this demonstration today. So this is kind of to show what % of the world's water is fresh water and is accessible to us. So our 5-gallon bucket here represents all of the water in the world. So if we take out 1 drop of the water, that represents the amount of water that's in our atmosphere.
Oh.
And if we take out 1 cup of water, this is all of the water that's locked up in ice caps and glaciers around the world. If we take 1/3 of a cup of the water out, this is all of the water that's in the ground, so all of our groundwater. So this water is accessible to us, but it's kind of locked up. If you take out 1/8 of a teaspoon, that is all of the water that's in our lakes. And then if you take just a little flick of water, that's the amount of water that's in our rivers. And then the rest of the water in this 5-gallon bucket is all in the ocean, which we can't use unless we use energy-intensive desalination. So it's really a simple exercise to show that out of this 5 gallons and all the water in the world, you know, less than a glass of this is fresh water that's accessible to us.
That's why it's so crucial.
Yep.
Tell me about Maji Safi. What does that mean?
So Maji Safi means clean water. So Maji means water and Safi means clean in Swahili. So you can think of us as the clean water group. And that's how everybody in Tanzania knows us, because Swahili is the national language there.
And tell me about your experience in Tanzania. Obviously, it was life-changing for you.
Yeah, so I first went to Tanzania when I was studying abroad at CU Boulder in 2009, and really fell in love with the culture and the people there, and really saw how much need there was for people to gain access to better health and clean water. So after graduating, the other co-founder of the organization, Max, and myself moved over to Tanzania, where we started Maji Safi Group, and really wanted to create an organization where we put the locals and the beneficiaries at the center of creating solutions to their own problems, and then enabling them to go out and teach each other to stay healthy.
And that's why Tanzania is central to this, is because you went abroad to study there and you saw the impact it would make.
Yep, you know, this is a problem that you see all over the world. Globally, 780 million people don't have access to improved or clean water source. And 2.3 billion, almost 35% of the global population doesn't have access to improved sanitation. So it really is a global problem that is a huge factor in the cycle of poverty and people spending their last dollar on treating these preventable diseases.
And of course, we don't think about that. You know, it's as easy as just turning the faucet on for us. Earlier, you told us about the health screening program. Tell me more.
So yeah, our health screening program enables us, since we do so much education, it can be hard to really see the real life impact of it unless you're there. So we started a health screening program where each year we test about 5,000 people for 4 diseases that we teach about. Half of the people we test are program participants, and the other half are community members who haven't had our education, so they're kind of our control group. And then we're able to measure the difference in disease rates among our participants versus people who haven't had our education.
Interesting.
And over the last 5 years, we've really seen that pretty much every disease is halved, or, you know, our participants only have a quarter of the disease rate. So
makes a big difference.
Yeah.
All right, let me give them information so they can get involved and help you out,
that'd be
Bruce.
great.
Thank you. We take, of course, for granted the sanitation, education, and disease prevention that we have available in the U.S. Access to clean water and proper education, it's a global problem. The Maji Safi group is able to take vital education and spread it to others in communities in rural Tanzania in hopes to improve their health and livelihood. To learn more and get involved with the Maji Safi group, visit their website. Go to majisafigroup.org, or you can follow them on Facebook at facebook.com/Maji Safi Group. Do it today. Pay it forward in life.